In the battle against hair loss, many of us feel like we're losing a fight we didn't even sign up for. The moment we start noticing those first signs, thinning at the temples, receding hairlines, or just less volume on the scalp, it can feel like everything is slipping away, almost like a slow fade into a future we didn't plan for. But what if I told you that the research on male pattern baldness has taken massive strides, and there are real, science backed solutions out there waiting to be explored? At the research paper, we're all about diving into the most promising studies, empowering minds with research backed wisdom. Today, we're about to take a look at some groundbreaking research on male pattern baldness and uncover how this wisdom can be turned into real, actionable steps for you. Let's explore the science of prevention and treatment, how we can finally take control. The first study we'll discuss was conducted by the American Academy of Dermatology in 2016. This study focused on the effectiveness of finasteride, a medication that has long been used to treat male pattern baldness. The research involved a sample size of over 1,200 men, all of whom were struggling with the early stages of hair loss. The participants were split into two groups. One group took finasteride, while the other group received a placebo. After 12 months, the results were staggering. Over 80% of men who took finasteride showed a significant reduction in hair loss, and some even experienced hair regrowth. So what does this mean for us, practically? If you're struggling with male pattern baldness, finasteride could be worth considering as a part of your treatment plan. But remember, it's not a miracle solution for everyone. Like any medication, it comes with potential side effects. Speak to your doctor to weigh the benefits and risks and see if it's a good fit for your situation. Now, let's turn to another critical study, one that examined the role of platelet-rich plasma, PRP therapy in treating hair loss. Published in the Journal of Dermatology in 2014, this study involved 75 male participants who were undergoing early stages of male pattern baldness. The participants received PRP injections directly into their scalp. The results? After 3 months of treatment, 70% of the participants experienced visible improvement in hair thickness and growth. Here's the application for you. PRP therapy could be something to discuss with your dermatologist if you're looking for a non-invasive, natural treatment. It's not a quick fix, it requires multiple sessions, but the science backs its potential. A word of caution, PRP can be expensive, and results may vary from person to person, so it's crucial to manage expectations and consider it as part of a broader treatment strategy. Finally, we can't talk about male pattern baldness without mentioning the power of lifestyle changes. A research paper published in 2020 in the International Journal of Trichology explored how diet, stress, and exercise impact hair health. The researchers found that men who maintained a balanced diet rich in vitamins, such as vitamin D, biotin, and zinc, had healthier hair follicles and a lower risk of hair thinning. Similarly, managing stress through activities like yoga or meditation significantly reduced the chances of hair loss accelerating. So, what can you do starting today? Focus on a diet that supports hair health, add those vitamins into your meals, and make exercise a daily part of your routine. But don't stop there. If stress is part of your daily grind, find ways to unwind and give your mind a break. Yoga, meditation, or even something as simple as deep breathing can do wonders. The truth is, research on male pattern baldness has come a long way, and we're learning more every day. But the most important lesson here? Prevention and treatment are not one size fits all. There's no single answer for everyone, but with the right combination of treatments and lifestyle changes, there's real hope for slowing down or even reversing the effects of hair loss. At the research paper, we'll keep exploring these kinds of studies, finding the wisdom that empowers you to take charge of your health. Because when it comes to hair loss, it's not just about finding treatments, it's about finding what works for you.